Is lack of knee cartilage causing your pain, or is it something else? We're going to dive into what really causes your arthritic knee pain and one of the most effective treatments for knee arthritis and cartilage damage that we've ever seen. So, if you have arthritis and you want to avoid a total knee replacement or knee surgery, then you are going to want to listen to this video. Stay to the end to learn the best way to heal your cartilage and damaged bone. If you're experiencing knee pain or arthritis, share your story in the comment section and what has not worked or has worked for you. Before we get into what works fast for knee arthritis to help you avoid the knee surgery, such as a total knee replacement, let's go into kind of what is wrong with our healthcare system and the path that we typically go down. So when you go and see a doctor, the first thing they want to do is let's go get an MRI, let's take some x-rays so that they can see what's going on with your knee. But here is the problem with that. If you go in and image your knee, as we get older, more things show. So when you look at and you give 100 people that have no pain whatsoever, 60 to 80% are going to show something, from degenerative changes to meniscal tears to whatever. So like that's just what happens as we get older. So it's kind of like we get wrinkles on our face as we get older. It's just a part of aging where we get wrinkles on our bones, we get wrinkles on our structure. And these people that went in for this MRI that are showing stuff have no pain whatsoever. So when you get an MRI, especially as we get older, you have to take it with a grain of salt. You have to go and figure out, is this really where my symptoms are coming from, or is it something else? I'm going to give you another example. Many times we've seen people go and they go into the doctor, they have knee pain, and their imaging from their knee looks horrible, but their knee pain isn't that bad. Like they have some knee pain, but it's not that bad. And the doctors are like, how are you walking? Like your knee looks horrible. And you can have another person that goes in, that gets an MRI, and their MRI doesn't look that bad, but they are in so much pain, they don't know, like they just can't stand it. And these are things that happen all the time. So we have to look at an MRI with a grain of salt. There's many things that can create knee pain, and we've got to look at what's going on. The second thing, cartilage. When you don't have cartilage in your knee, cartilage does not have a nerve supply. It doesn't really have that much of a blood supply, which is why it can't really heal. But if you don't have a nerve supply, then you're not going to have pain. So you can have people that have no cartilage and they have no pain. They're like, I don't understand. Like, how are you functioning? But you can have other people that have no cartilage and they have so much pain. Where does that pain come from? It comes from the bones and the structures around the knee. That's what causes it. And when you have a lack of blood supply because the tissue becomes more degenerative, it stops healing, whatever the case may be, whether it's soft tissue muscles around the knee or it's the bone itself, then you are going to have pain. So what is the fastest way that we've been able to help our clients? So when we do an evaluation with our clients, we're assessing them to figure out what is the best course of treatment. And when people really truly have that bone pain, bone edema, then we end up recommending doing something called focused shockwave, which is what this is over here. And what does focused shockwave do? Well, this actually can affect the bone. It can bring blood supply back to that bone. It takes away the bone edema like that. So people will get results in that first treatment going, oh my God, this is the best my knee's felt in like 10 years. I know because I've done it to my knee. And I was so excited to get it because I felt so good after the first treatment. Like I cannot wait to finish my 6 so that I can get back to feeling so much better, because I've been compensating for the years of abuse that I've done and the multiple surgeries that I've had on my knee. And I really did not want to have a total knee replacement. And so that's the reason why I got this. So the other thing that will happen is you can get degenerative changes around your muscles, the structures around your knee, specifically around the quad. That's down below. And so that's when we use the radial shockwave, which is a different unit that's down below this unit here. And that'll really, again, it'll start the healing process again, bring blood flow to the tissues because you've just lost it. The body said, I'm done healing, and it just like, there's nothing there. And every time you try to move and you try to get those muscles to fire, they don't fire, and you feel it in your knee joint. And so these things are things that can help us tremendously when someone comes in with bone edema, bone pain, degenerative changes around their knee joint. They can literally, we can wipe it out really fast. I'm going to give you an example. We had someone that's had multiple knee surgeries, stem cell injections, all these things. And her knee pain was giving her problems. And the doctor said, we need to do a total knee replacement. And she didn't want to do it. So she came in and we did shockwave, and come to find out, it really wasn't her knee joint that was a problem. It was a little bit below her knee joint, which was called the tib fib. It wasn't moving very well, and I could just tell there was a lot of scarring on that lateral compartment of that knee joint. And so we went and did shockwave on it, and she was like, oh my God, this is amazing. Like, I don't feel like my knee's going to give away. The pain is almost gone. But again, we need 6 treatments for it to really last. Now, the beauty also of this is if there really truly is stuff going on inside that knee joint, we can literally use this. We can use this handle right here, take this part off, and this actually can go through the whole entire knee joint. So we literally can get in through that knee joint where there might be some bony changes that are happening in that knee joint to start healing those areas. And it produces stem cells. It produces our own body's stem cells so that we can start regenerating some of that tissue that's there. And it's been amazing. It's been something that we've been able to use to speed up the healing, to help people avoid the surgery, and then get back to doing some strengthening where their muscles actually can fire. They can get their muscles stronger around the knee to protect it, to help them avoid future surgeries down the road. So if you're interested in learning more, definitely go into the description. We have some other resources in there that you will be able to have access to, from knee pain to regenerative type therapy. We have some videos on it, as well as some resources that you can have to just learn more on how this might be a solution for you. And if you live in the Dallas-Fort Worth area and you're like, yes, I want this. I want to come in and do these 6 treatments. I want an evaluation to see if this is going to be the best option for me. Definitely sign up for our discovery visit that's actually in the description as well. And we can start the process towards getting you some more education and finding out if this really is going to be a solution for you. Again, my name is Stephanie. I'm with Empower Physical Therapy. We help clients avoid surgery, injections, and medications while getting their life back. Our whole goal is to teach you what you can do and help you put the pieces of the puzzle together to get you back to feeling your best.